Enter into the hidden and destructive world of intracellular microorganisms that reproduce and multiply by invading cells using the mechanism of phagocytosis. Intracellular organisms called ICOs live primarily off organisms like ticks, fleas, lice, mites, and other acaridae carried by animals. In turn, these insects must seek out food which guarantees the transmission and survival of the intracellular organisms. And within the cycle, humans and their pets are not exempt from infection. During her life, this goat will leave behind one or more placentas, as do all herbivores. These placentas will soon be dried out by the sun and reduced to dust, the ultimate expression of any DNA. In turn, dust provides a means of entering the open eyes, the respiratory organs, and gaining direct access to the digestive system. Any abrasions on the surface of the skin may also offer an entry point. When the skin is exposed to contaminated water, it becomes a common target for the bilharzia worm. Due to their size, bilharzia worms are often felt as a vibration when they transit into the vascular system. Rickettsia and other microorganisms can also be transmitted through blood, meat, and other infected products, like unpasteurized milk, cheese, cotton, and sand. The secretive rat leaves behind fresh excretory products and fecal matter wherever he goes. Although not always visible, these excretions are pathogenic when entering via cutaneous, ocular, respiratory, or digestive pathways. Rickettsia, Lyme, borreliosis, and others enter the blood flow. Once in the blood, they cause acute or primary infection that mimics a flu-like illness. In order to survive and reproduce, they have to penetrate the cytoplasm of host cells, which they do using the mechanism of phagocytosis. That brings them right into the cytoplasm where food is available. Now comes the time for reproduction by binary fission inside the cytoplasm of endothelial cells. Oxygen, sugar, electrolytes, iron, and vitamins are stolen from the human body to ensure the ICO survival. There are obvious vascular changes in the body. Due to the multiplication of the ICO, the endothelial cells swell and the cell membrane becomes distended. This narrows the passage of the blood, causing intermittent high blood pressure. As the Rickettsiae continue to multiply, the cells become full and burst. The rickettsial corpuscles are flung into the bloodstream, causing a release of toxins, like endotoxins that cause pain, allergens that trigger allergies, and neurotoxins, producing neurological and psychological imbalances. The host's alarm devices or inflammatory mechanisms are activated. Fever rages, patients perspire profusely, headaches flare up, hearts race, joints swell, and muscles ache. Nausea occurs and a metal taste in the mouth is experienced. Anxiety and panic attacks with shortness of breath and blurred vision. The tearing of blood vessels results in bruises, aneurysms, varicose veins, and other conditions. Rickettsia invade and damage tissue in different organs. Blood tests often show dysfunction of white cells, red cells, platelets, ESR, liver, pancreas, iron, and picks up an increase in cholesterol. The immune system's production of antibodies carries on without necessarily recognizing the bugs as the primary stimulus. The confused host attacks itself by producing elevated levels of autoimmune factors called rheumatoid factor, anti-nuclear factors, CRP, CK, cardiolipines, IgE, and thyroid antibodies. The thyroid, the joints, the muscles, the intestine, the heart, the lungs, the liver, the testes, the uterus and ovaries, the brain, and other neurological tissues are caught in the crossfire. Bombarded by antibodies, they go through a self-destructive process. The rush of cytokines happens, creating strange body aches, amazing allergies, or weird neurological and psychological symptoms. The immune system becomes suicidal. The patient steps into the classification of autoimmune disease and out of no man's land like CFS, ME, yuppie flu, fibromyalgia, and depression. All along the intracellular organism's trajectory sheets, like peritoneum, pleura, pericardium, epiploic membrane, and vaginal mucosa, become inflamed and start exudation. This engulfing of the vascular territory will not pass unnoticed, and a general vasculitis will take place, reversible or not. We are a vascular system from top to toe, and that is why a huge range of symptoms are exhibited. So wide is the range that the physician quickly runs out of diagnostic options and eventually loses his Latin altogether. The treatment given by a non-informed practitioner will be symptomatic, consisting of painkillers, antidepressants and supplements. In the presence of autoimmune diseases, the use of cortisone and/or chemotherapy is introduced, regardless of which disease emerges. This suppresses some normal and abnormal cells, as well as the immune system. If the autoimmune factors fail to destroy abnormal cells, these cells will carry on reproducing in the same way that normal cells reproduce. This process will clone abnormal cells and lead to cancer. Any intervention that takes place without aiming for a cause will fail, because of this simple truth: no cause, no solution. Rickettsia are real vascular sponges, paralyzing everything. Leech-like, little by little, the vessel disintegrates, the brain becomes soaked with toxins, muscle melts, myelin disappears, the bone surface loses its polish, and necrotic tissue accumulates. Paul Giroux.